Hmong and chronic hepatitis B, presented by Angel Zhang. So what is the problem? Chronic hepatitis B is a viral infection that is transmitted through bodily fluids. This disease shows no symptoms until the infected person develops liver failure, liver cirrhosis, or liver cancer, which would already be too late for treatment. This disease, although preventable, infects as many people as HIV does. Statistics from the CDC website show that the prevalence rate of chronic hepatitis B in the U.S. is 5 per thousand, leading to 1.2 million infected persons. In California, the prevalence rate is 8 per thousand, leading to 280,000 infected persons. Narrowing down to Merced County, there is no data or statistics to show the prevalence rate, but it can be estimated to at least 8 per thousand. Statistics retrieved from the Stanford Liver Center show that an ethnic disparity exists with chronic hepatitis B. With one of the highest prevalence rates in the Central Valley, the Hmong experience 200 cases per thousand people. Other Asian Pacific Islanders only experience 100 cases per thousand people. At an even lower rate, African Americans, Caucasians, and Hispanics show 5 or less cases per thousand people. From these statistics, we can see that Hmong are the most vulnerable to hepatitis B. But why is that? Some contributing factors to this disparity are the fact that Hmong are recent immigrants from the jungles of Laos and Thailand, where no one knew the disease existed. Therefore, there was no need for vaccination. Immigrating to the U.S., they came with hepatitis B, which would then be passed on to their children via perinatal transmission from mother to child. Now, 51% of Hmong are at a financial disadvantage, living in conditions of poverty or less. Many depend on government support, such as WIC, food stamps, SSI, and Medi-Cal to support their family and daily lives. As immigrants, they experience cultural and language barriers. 49% of Hmong do not speak English well or at all. Even worse is the cultural barrier, where Hmong find it hard to accept Western medicine, and Western medicine find it hard to believe in spirits. But why does this matter? Merced County has approximately 9,000 Hmong residents, leading to a possible 1,800 infected Hmong people. If this does not seem like a high number, think about the fact that there is a small population of Hmong in the world compared to other ethnic groups. I was given the chance to interview Tu, a 21-year-old male and former UC Merced student, whose name has been changed for privacy purposes. Tu was diagnosed with chronic hepatitis B while trying to donate blood. Upon arriving home that day, he refrained from telling his mom, but suggested that his siblings be tested for the disease. In response, she gave him a long lecture about the financial status and the fact that their family had no health insurance. Discouraged by this response, he has not told his mother and has not seen a physician to discuss his condition. Currently, he does not know the severity of his infection and has felt helpless since. He ignores the disease, but has stopped drinking alcohol and socializing. After finding out that Hmong have one of the highest prevalence rates in Merced, he wants to help promote awareness and prevention of this threat to the Hmong community, so that other Hmong people do not have to feel as lonely as he did. Ironically, UC Merced students are required to have taken the hepatitis B vaccine before attending school. So why did Tu have hepatitis B even though he had taken the vaccine? Most likely because he had the disease before taking the vaccine. The physician who gave him his vaccination didn't check. Some other contributing factors are that at the individual level, Hmong are not aware of this issue, and many are not educated. Many Hmong have not been screened or vaccinated either. At the group level, cultural and language barriers are blocking our ability to promote and improve health and wellness. Similarly, the Hmong have very few advocates to help promote such disparities. At the community level, it should be mandated that patients are screened before considering vaccination, and all pregnant women get prenatal care and perinatal treatment. Most importantly, Merced County needs to update its data and statistics on such diseases. Some behaviors that we can change now to promote awareness and get people screened and vaccinated are to prevent perinatal transmission. In an experimental study by Beasley and his colleagues, babies receiving hepatitis B immunoglobulin and vaccination immediately after birth showed a lower chance of getting chronic hepatitis B from their mothers. This method was 95% more efficient than any other method, such as taking vaccination alone. Something that has been changed in Merced County is the creation of the Healthy House organization to help decrease the cultural and language barriers that exist for the Hmong. With the help of interpreters and cultural advocates, it will be easier to promote and improve health and wellness in the Hmong community, hopefully decreasing the prevalence rate of chronic hepatitis B. So what's next? Well, the threat of hepatitis B does not affect only the Hmong, but Merced County as a whole. With an approximate 9,000 residents, we need to stop hepatitis B from spreading. Therefore, we will need help from the community to fight this threat and build strong connections between the group and individual levels to promote prevention, promote awareness, and promote treatment for those who do have chronic hepatitis B.